I'm Dana Griffith, the Executive Program Director for K-12 Schools here at HealthMPowers.
Hi, and I'm Anaise Quirindongo, the Program Analyst for our SNAP-Ed program. The SNAP-Ed program is the educational arm of the Supplemental Nutrition Assistance Program.
At HealthMPowers, we strive to make sure that all children across the state of Georgia are nourished and active. One way we do this is by providing K-12 schools with programs, resources, training, and services targeting enhanced nutrition and physical activity behavior. That's why Anaise and I make such a great team. One of the things we do at HealthMPowers is center youth voice and put kids at the forefront of all of our decisions, programs, and choices. One of the programs that really highlights this is the Student Health Advocate program. Our Student Health Advocates ensure that students are the leaders and the change agents in their schools. They're the ones driving healthy behaviors, not the adults. While the Student Health Advocate program has been around for 5 years, during the 2021-2022 school year, this became a core part of all of our elementary SNAP-Ed programs. During the 2021-2022 school year, we piloted the Student Health Advocate program with Bibb County Schools, one of our SNAP-Ed partners. During that year, 19 elementary schools implemented the program. Over 200 students led the charge to enhance physical activity and nutrition behaviors in their schools. They did this by selecting different projects that they chose to implement. The adults worked to help them, but the initiatives were led by the kids and were for the kids.
In analyzing the data from our pilot program, we had great trends across the board. All of our behavior data trended in the positive direction, and we had statistically significant improvements in our fruit consumption. We also had really huge gains in knowledge from all of our elementary participants. Here you can see the results from our pilot program, and it is aggregated by our exercise, fruit, and vegetable consumption categories. You can see the great gains across the board in fruit and in vegetable consumptions. We're going to take a little bit of a deeper look at the exercise portion of the graph here. Here we can take a deeper look at the physical activity data. When looking at it in the previous slide, it can be hard to see any changes with the data compiled all together. But when you look at it here broken down, you can see that there was a huge decrease in the amount of students who weren't moving at all. And there was an increase in the students who were moving more throughout the week. Any increase in students moving more throughout the week is a win in our book. And lastly, here are the results from our knowledge assessment. In addition to measuring behavior data from our students, we also like to measure knowledge to make sure that they know how to make healthy choices. You can see that there were huge gains in each categories, and students are learning more about the recommended number of servings of fruits, vegetables, and amount of exercise per week.
Thank you so much for joining us to find out more about what HealthMPowers has to offer and how we center youth voice in all that we do. Be sure to follow us on our social channels at HealthMPowers.
And also be sure to check out all of our great resources at healthmpowers.org.